Welcome to part 2 of Integumentary, where we're going to talk about skin conditions. A common skin condition seen in nursing is inflammation and edema. Some conditions will use these terms to mean the exact same thing, but in some conditions they are two very different terms with very different meanings. Regardless of which term we're discussing, the terms mean there is something causing the tissues to swell with fluid. These conditions could be chronic or acute. A chronic condition we discussed this semester would be heart failure, and an acute one is musculoskeletal injuries like sprains. Inflammation is what occurs when there is some sort of localized injury. The body senses the injury and releases chemicals to release fluid into the tissues, calls for white blood cells to come break down the damaged tissue, and then heals and repairs the damage. Inflammation also often has visible swelling, redness, pain, and warmth. Depending on the injury, there could be loss of function, like when you can't walk on a sprained ankle. Edema is also swelling of the body tissues, but not in response to some sort of trauma. Edema is caused by changes in hydrostatic pressure that causes the capillaries to leak fluid. This can be caused by too much fluid in the body or fluid overload in heart failure, certain disease conditions like kidney failure or low serum albumin levels. I did mention albumin was important. If albumin levels are low, the capillaries leak into the tissues. We will see people with malnutrition develop edema. Edema can occur in any body tissue, in the lungs, abdomen, ankles, legs, arms. If it's tissue, it can have edema. There are many different types of skin lesions a person can have, and honestly, depending on the type of nurse you become, you may see a lot of these or you may never see some of these at all. When we assess skin lesions, we need to be mindful that skin lesions vary in appearance, size, shape, and distribution, and all of these help classify lesions and find the cause. When we assess these, we need to look at the color, any redness, heat, pain, swelling, the size and location, the pattern, and where these lesions are located. We need to document all of this information as well. Certain diseases can have skin conditions associated with them, like chickenpox. We have 3 different types of skin lesions: primary, secondary, and vascular. Primary skin lesions are the initial lesions and are characterized by the disease itself. Primary lesions include macules, papules, nodules, vesicles, wheals, pustules, and cysts. Secondary lesions result from changes in the primary lesion from external causes like scratching, trauma, and infection. Secondary lesions include erosions, ulcers, fissures, scales, crusts, scars, keloids, atrophy, and lichenification. Vascular lesions are a little bit more common to see in nursing. Petechiae are tiny little bruises on the skin and are diagnostic for some diseases we commonly see in nursing. Ecchymosis is bruising, and we see a lot of this. Ecchymosis can have all different shades of colors depending on the stage of healing it's in. Then we have cherry and spider angiomas, which are common vascular lesions as we age. Funny story, when I was very early pregnant with my son, I developed a little spider angioma on my finger, and I looked down at it and I thought, those are really common with pregnancy. And then a couple weeks later, I found out I was pregnant. And he was born with a little spider angioma in the exact same place on the exact same finger, so it was pretty cool. And then we have telangiectasias. They are like varicose veins, and these are very common in people who stand a lot, and they're usually found on the legs. Pruritus, or itching, is the most common symptom of skin disorders. It may also be the first indication that the patient could have a disease occurring like diabetes, blood disorders, or even cancer. Pruritus can be caused by many other things as well. Medication reaction can cause itching, especially with aspirin, antibiotics, hormones, and opioids. Chemicals on the skin and soaps and skincare products can cause itching as well as some psychological and psychosocial disorders. Finding the cause and stopping it is the first and best treatment for pruritus, but there are things we can do to lessen the itching while we wait for the cause to resolve. Not scratching the skin until it bleeds is helpful. So is taking tepid water baths instead of hot water. Not rubbing the skin with a towel will help, along with mild, low chemical body lotions. Also, avoiding situations that would increase your body temperature and cause sweating will help lessen itching. Fungal infections are fairly common in humans, but not very common for nurses to see. A lot of fungal infections attack the skin and nails, which nurses don't see a lot. Sometimes fungi can attack the lungs and bloodstream, and those infections can become critically ill, and nurses would definitely see those. But for this presentation, we're only discussing skin and nail fungal infections. The most common type of fungal infection are from tinea, which we call ringworm. It's actually a fungus and not a worm at all. We also see candidiasis, especially in the moist skin regions like the axilla, the groin, and the feet. A provider can take a scraping sample of these fungal lesions to see which fungus is growing, but a lot of time treatment is based off the location and the appearance. Many treatments for fungal skin infections are over the counter and usually have good results if the patient takes some hygiene steps. First, the instructions for the treatment must be followed exactly. Fungal infections require consistency every day, as many times a day as they're supposed to actually get the medication to work. People should also use a clean towel with each bathing because fungal spores spread easily. They also should not share any personal items. All moist skin areas should be kept as dry as possible, including wearing clean, dry cotton clothing to prevent excess heat and moisture on the skin. Scabies are skin mites that burrow in the skin and frequently involve skin folds like the fingers and hands, which may spread the mites to other areas and other people. Scabies cause intense itching from the mites moving and laying eggs in the skin, and it's usually worse at night. Diagnosis is from inspection, or scrapings can be done to look for eggs and mites under a microscope. The treatment for scabies is easy and effective if everyone in close contact is treated at the same time. It's so contagious that the whole body needs to be treated to kill all the eggs and mites. Healthcare workers should wear gloves, and some facilities may place these people in contact precautions to prevent the spread to other patients. Clothing and bedding needs to be washed in hot water and dried in a hot dryer to kill the mites. The person also needs to repeat the treatment 1 week later to make sure all the mites and eggs are killed. The person also needs to know that the pruritus can last for weeks. There are two more common types of parasite-related skin issues, ticks and bedbugs. Ticks are bugs that bite humans for blood. Their heads burrow into the skin and they drink the blood of their host. They also secrete enzymes and bacteria into their host. To remove ticks, they have to be removed very carefully so the entire tick, including the head, is removed. If the head is not removed, it can stay in the skin and cause infection. Ticks can carry diseases that can cause fever and chill, aches and pains, and rash. Some of these diseases can cause serious disease and disability, and some have long-term and chronic effects. The treatment of these diseases depends on the illness contracted, but usually involves antibiotics like doxycycline. Bedbugs are small, reddish-brown, blood-sucking, wingless insects. They tend to live in mattresses and bite hundreds of times at night. The risk of encountering bedbugs is higher if you spend time in places where nighttime guests come and go often, such as hotels, hospitals, and homeless shelters. Bedbugs usually clear up without any treatment in a week or two if the infestation is killed by professional extermination. Bedbugs aren't known to spread disease, but they can cause an allergic reaction or severe skin reaction in some people. Regardless of the skin condition, the objective of care is to prevent additional damage, infection, relieve symptoms, and reverse the inflammation process. Nurses also provide the medications for treatment and provide wound care. In addition, we do a lot of patient education to prevent reoccurrence and to promote and improve hygiene. And this is the end of part 2.